WHO, that's the World Health Organization, had visited a number of states. These include Imo, Anambra, Rivers, Delta, Kano, and Katsina. Of course, they still have a number of states to cover.
And beyond this, Nigerians have been admonished to use face masks in addition to the routine measures of social distancing and personal hygiene. But central to response mechanism, many insist, is the level of testing in mitigating community transmission.
Now, there are reports, for instance, that Ghana, at the beginning of the week, with a record of over 800 cases that's of persons infected, had tested some 60,000 of its citizens, who number some 30 million. But on the other hand, Nigeria, as at Tuesday this week, had tested just about 8,000 persons out of a population of 200 million, although we don't expect everybody to be tested.
Exactly. Right. And just last week on this platform, we hosted the Chief Executive of Nasarawa State and representatives from Anambra, Niger, and the FCT to ascertain the level of preparedness in the case of any eventuality and to share their experiences, especially in testing kits, state of health facilities, and contact tracing where necessary, as cases of COVID-19 keeps spiking.
Well, it's so interesting that Adamawa State has now recorded its first case of COVID-19, and this was just some hours ago, which further buttresses the fact that we are going to, of course, have to move on with the containment strategies against community transmission. But one question to ask, of course, will be what level of preparedness do we have in those states where coronavirus hasn't made a landfall yet, or where it has made a landfall to ensure that it doesn't continue to spread amongst the people. And more particularly, we shall be taking a look at the level of infrastructure. My name is Kingsley Osadolo, and it's Good Morning Nigeria. We welcome you to the program.
And I am Kirian Umayo, also welcoming to the show. We shall also bring you our usual complementary segments of the program, which will include the newspaper review, business, and others. For now, Chimobi Walter Naji is set to give us highlights of the morning news. Hello, Chimobi.
Hello, Kirin and Kingsley. It's good to see you this morning. Good morning, Nigeria, and welcome to the morning news. Now, as at 11:25 p.m. on April 22nd, the NCDC announced 91 new cases in Nigeria, increasing the number of confirmed cases to 873. Now, of the 91 new cases, 74 are in Lagos, 5 in Katsina, 4 in Ogun, 2 in Delta, 2 in Edo, and 1 each in Kwara, Oyo, FCT, and Adamawa states. 197 patients have been discharged, with 28 deaths recorded so far. The Presidential Task Force on COVID-19 has appealed to state governments to ensure compliance with the directives by the Sultan of Sokoto for Muslims to avoid congregational prayers during the coming Ramadan period. Now, this was at the daily briefing by the task force in Abuja.
To thank His Eminence, the Sultan of Sokoto, for endorsing the recommendations of the Emergency Fatwa Committee by issuing a statement on the suspension of obligatory religious activities such as Jumat, congregational, and other sessions during the month of Ramadan.
Federal Ministry of Health, through the Chief Consultant Epidemiologist, has been with the Public Health Department of Kano State to find out what was true about the news of burials going on there. If these burials were out of normal and they are carrying out further questioning of people to see what was peculiar.
We'll now take you to Kaduna State, where the Chief Executive, the Governor Nasir El-Rufai, has tested negative for COVID-19 after 4 weeks of isolation and strict medication. Now, the Governor confirmed this through a non-conventional video broadcast to the people of Kaduna State.
We must all work hard to ensure that we keep coronavirus or COVID-19 out of Kaduna State. We have lower infection rates than expected due to the stringent measures we imposed very early in our state. But we cannot let our guards down. We live in dangerous times. This disease is a threat to our humanity, our lives and our livelihoods.
And in the neighboring Kano state, government is taking additional control measures against community transmission of COVID-19. The Deputy Governor and Chairman of the State Task Force on COVID-19, Nasiru Gauna, who disclosed this at a news conference, explained that this is coming against the increasing rate of transmission in the last few days.
We have listed over 300 contacts, and we are following up on 259 of these contacts.
We urge the people of Kano State to strictly adhere to the advice of the professionals.
Now, in these days of coronavirus war, yes, it is a war, and everybody is putting effort to win it. So it is encouraging and heartwarming that as the federal government continues to deploy resources to winning this war, more Nigerians are not just giving it a pat on the back, but also doing the needful.
We've seen what is happening in places like the United States of America, where over 40,000 people have died. We can't afford such an outbreak in Nigeria. So whatever we can do to contain and to curtail this spread, the better it is for us as a nation. So every well-meaning Nigeria, organizations, institutions should please come out and give the support they can towards the fight of this pandemic.
We use this as well to preach to other Nigerians that there is every need to protect ourselves against this deadly virus.
Now, amidst the ravaging effect of COVID-19 and subsequent crash in oil prices, the three tiers of government still got up to 780.926 billion naira raised in the month of March to share at the Federal Accounts Allocation Committee, FAC. And a statement of accounts issued by the Federation Accounts Allocation Committee in Abuja indicates that the amount comprises statutory revenue valued at value-added tax and exchange gain, and balance in the excess crude account now stands at $72.221 million. The statement by Henshaw Ogubike, Director Information Office of the Accountant General of the Federation, reveals that in the month of March, taxes, duties and royalties all recorded substantial increases. The monthly meeting was held through virtual conferencing due to the lockdown in Abuja and some states of the Federation occasioned by the COVID-19 pandemic. Still with the finance sector, the Economic Sustainability Committee, chaired by the Vice President Yemi Osinbajo, is expanding the pool of options open to Nigeria in achieving the administration's plan to turn the current economic challenges to opportunities for Nigerians. Now, the new sustainability plan is almost ready for submission to the President for approval.
What Mr. President has asked us to do is to devise a strategy in order to be able to keep the economy going, and also to make provisions to ensure that we're able to retain jobs and indeed even provide more jobs.
And President Muhammadu Buhari has received more condolence messages from presidents of Guinea-Bissau, General Umar Sissoko Embalo, Guinea Conakry, Professor Alpha Conde, Liberia, Dr. George Mane, and Benin Republic, Patrice Talon, over the passing of former Chief of Staff Malam Abba Kyari. All right, and that concludes the news highlights for now. Good morning, Nigeria. On COVID-19, situation reports in states will continue with Kingsley and Kerry. And after this break, I'm Chimobi Walter Nudge. Good morning.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Improved household hygiene is essential to keep your family safe. Did you know that the sodium hypochlorite, the active ingredient in hypo bleach, is equipped to fight viruses and germs? Add some bleach to water, soak a clean napkin in diluted bleach, and wipe off germs from common contact surfaces. Wipe off with hypo. Disinfect your home with hypo bleach always.
Endorsed by the Nigerian Medical Association.
As you can see, I'm at home. I'm reading a book. When I get bored, I watch movies. Life has not stopped. Together we can beat this thing. All we have to do is make sure we do the necessary things, which is wash our hands, use a hand sanitizer frequently, wash your hands with soap. Please avoid crowded environments, crowded places. If you must head out maybe to get groceries, use the face mask. So please stay safe, stay responsible, and stay at home.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
The main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is Good Morning Nigeria on the network service of NTA. Now we are talking business. And the federal government unfolds new strategies towards curbing food shortages. Details with Abdul Karim Zurumi.
The new plans for free movement of agricultural produce nationwide was unveiled in Abuja to reduce food shortages in the country within the period of the COVID-19 lockdown. Minister of Agriculture, Sabo Nanono, who disclosed this at a meeting in Abuja, has further appealed to relevant security agencies to allow vehicles conveying perishable goods, such as farm products, livestock, and farm inputs, to pass through without compromising on health or national security measures. He says this will serve as a pardon for sellers, as it will ensure safe operations of farmers, grain markets, livestock, dealers, and sellers during the lockdown. In the meantime, average price of 1 kilogram of rice increased by 21% year-on-year to 438.66 naira in March 2020. Selected Food Price Watch data for March 2020 reflected that the average price of 1 dozen of agric eggs, medium-sized, increased year-on-year by 0.29% and month-on-month by 2.87% to 461.15 naira in March 2020 from 448.26 naira in February 2020. Now let's head to the floor of the Nigerian Stock Exchange to see how the market fared on Wednesday, 22nd of April, 2020. With business news, Abdul Karim Zurmi.
Many thanks, Abdul Karim, for the business package. Newspaper review is next.
Joining us now is newspaper reviewer Bayo Atoyabe. Very good morning.
Thank you. Good morning. Good morning, Kesi. Good morning, Nigeria.
Okay, so let's begin our review this morning by taking a look at the Leadership newspaper. Leadership below the nameplate says Prince Charles, Kagame, and Sambo condole with President Muhammadu Buhari over Abba Kyari's death. And below that, Nigerian Air Force at 56, Air Chief lauds troops for sacrifice and patriotism. Details on page 24. This story, expected list on coronavirus. Coronavirus real and spreading like fire. Federal government warns Nigerians. And you have a number of riders that links rising cases to increased testing and community transmission. Governors agree on 14-day lockdown in states. Governors agree on 14-day lockdown in states. Edo DCP, that's the Deputy Commissioner of Police, dies of coronavirus. El Rufai recovers and tests negative. Senator Barau begs federal government as NCDC suspends testing in Kano. Gombe governor imposes curfew and Bauchi governor reviews budget. Nigeria can develop COVID-19 vaccine. That's according to ASU. States comply with President Buhari's directive, release more inmates. Ramadan, that's below the photograph on the front page there. Sultan asks Muslims to look out for moon. And what Nigeria earned from crude oil sales is there on the front page. Together with what's being shared at FAC. Outrage over Lebanese attempt to sell Nigerian girl for $1,000. That's page 8. And bandits pose threat to food security, page 24. Gideon.
All right. Now, let's turn to the Daily Sun newspaper on the right-hand side of the nameplate. Again, federal government expresses concern over Kano cases, with the rider backs Lagos on door-to-door testing. That's on page 8 now. Federal government insists ASU members fill IPPIS form, provide BVN before payment. That's on page 8. Now, the lead story on the Daily Sun, COVID-19, NMA prefers solution. recommends enforcement of mandatory face mask use. Governors call for decentralized response to community transmission. Federal government says complete lockdown claims fake. That's on page 6. Of course, the photo story there is that of those who were intercepted by security agents for violating the lockdown order by Osun State government. They were actually riding in a truck. All right, and below that, Omahe under fire over impunity against journalists. It's on pages 4 and 5. NUJ, NGE, SERAP, IPOP condemn Ebonyi governor's ban of the Sun and Vanguard reporters from Government House and other government facilities. That story is also on page 4 and 5. Now, Northern governors ban Almajiri system, evacuate them to states of origin. Page 26. Rising Abuja cases traced to slums and settlements. Infight and rocks FCT Ministerial Committee. That's the writer to that story. It's on page 6. Now, oil price nears $21, $9 below 2020 budget benchmark. That's on page 2. That's where you get the story. Well, I don't know whether it's necessary for us to look at the COVID-19 index, by a sun. It's on the right-hand side towards the bottom. You can see the index there. COVID-19 cases in Nigeria, 873 confirmed cases, 197 recovered, and 28 deaths. And of course, it shows how the cases are distributed. Lagos 509, FCT 118, Kano 73, Osun 20, Ogun 19, Oyo 17, Katsina 21, Edo 17, Kwara 9, Kaduna 9, Akwa Ibom 9, Borno 9, Bauchi 8, Gombe 5, Delta 6, Ekiti 4, Ondo 3, 3 Jigawa, 2 Enugu, 2 Niger, Abia 2 Benue, and 1 Anambra and 1 Sokoto. That's covered about 25 states of the Federation. And of course, Ramadan, Sultan directs Muslims to look out for crescent moon tomorrow. That's on page 3 of the Daily Sun. Well, let's bring in Bayo now for further analysis.
Indeed, Kieran, thank you very much. Like Kingsley read there, the COVID-19 is spreading like wildfire. It's now gotten to 25 of our 36 states. And while we were lamenting yesterday that we had the highest of 87, that of yesterday has been passed by 91 new cases that were reported by the Nigerian Center for Disease Control yesterday. That gives us a tally of 873 cases, and within this same period, we have had 197 persons recovered. So we have 676 active cases. Unfortunately, we have lost 28 of our compatriots to COVID-19. Meanwhile, governors of the states of the Federation have agreed on an interstate lockdown for 2 weeks. The chairman of the Nigerian Governors Forum, who is governor of Ekiti State, said that this was reached at the 6th COVID-19 teleconference meeting of the governors. And the agreement is based on the fact that there are now infections in 25 states, and they have to put their heads together to do something about a decentralization of the COVID-19 resources as a positive step in checking the spread of the COVID virus. This, they say, is the best chance of nipping the growing community transmission in the bud. There has been an explanation why Kano Testing Center was closed. First, they had to halt testing because they had run out of reagents and kits. However, the Minister of Health also indicated that some workers at the laboratory had tested negative. But meanwhile, the lab has now been shut for decontamination, and there have been a replenishment of personal PPE, personal body effects, as well as reagents to enable the Kano laboratory to continue. Meanwhile, the Kano state governor has also explained that they relaxed the lockdown in Kano to enable citizens purchase items in preparation for Ramadan, which is likely to start at any time. At another level, the Ministry of Health also conveyed emergency national conference of National Council of Health. This was done through a teleconference, and in this review, it has agreed that henceforth, persons diagnosed with COVID-19 will be treated in the state where they are diagnosed. In other words, they will no longer be required to move to their state of origin. This movement to the state of origin is likely to cause effect of more transmission of the disease. Also, the Council of Health has said that patent medicine stores as well as pharmacies are prohibited from treating suspected COVID-19 cases. Anyone who dares to do it will have their license seized. Also, as part of the initiative, they have now said that primary health care centers, their personnel will now have to lead the initiative for community tracing. And that in this regard, they will have to look out for participating in surveillance, to look out for persons who are requiring treatment as well as those who are requiring tests. Meanwhile, the Chinese medical personnel who accompanied the donations by the CCEECC have now spent the equivalent of 14 days in isolation. They are to be tested before they go out for the assignment abroad. Then. The positive news from COVID-19 now is that Governor Nasir El-Rufai of Kaduna State has tested negative. He first tested negative on Saturday, and the second test yesterday confirmed the negativity of his symptoms. He expressed appreciation to all who expressed concern. And if you see Governor Nasir El-Rufai, he's now sporting a beard. He says he's wearing that as a trademark for the period of his COVID-19. Meanwhile, the national coordinator of the Presidential Task Force for the COVID-19, Dr. Sani Aliu, says that the information put out there that there was going to be a complete lockdown did not emanate from the Presidential Task Force. And he also lamented that in spite of the challenge and the danger with COVID-19, people are still playing pranks with fake news and publishing false information about that. Meanwhile, away from COVID-19, the Federation account allocation has met. And for March, there's been distribution of 780.393 billion for all tiers of government. Federal government got 264.3 billion, state got 181.48, while local government got 35.9. 13% derivation accrued 38.75 billion and is going to the states under that auspices. Excess crude account now stands at $72.22 million. On Ramadan, His Eminence the Sultan has enjoyed Muslims to look out for the crescent of the Ramadan move tonight. Today is the 29th of Shaban, and if the moon is sighted, Ramadan will commence tomorrow. However, if it is not sighted, upon Shaban completing 30 days, it means Ramadan will have to be on Saturday.
Okay. The two stories there that of particular interest, Kirian, and the one has to do with the Ebonyi State harassment of journalists. I mean, the stories have been trending for some time. And then the other also has to do with the reports that say governors are agreeing on a 14-day lockdown in order to also further disrupt community transmission of COVID-19. I just want to speak to the second point, which has to do with the meeting of governors. This was by way of teleconferencing. Now, on Good Morning Nigeria last week, we discussed, working from home. And our guests did indicate that the nature of work, of course, is changing, and COVID-19 is likely to have an impact on how work is done in a good number of cases. Now, why am I saying this? I mean, the governors, let's say the Nigerian Governors Forum, met via teleconference yesterday, and they arrived at this decision, laudable as it were. In the past, you would have, of course, seen that the governors would have all converged in Abuja. And that is costly. If you want to reduce the cost of governors, a number of the state governors would have had to hire commercial aircraft, or charter aircraft to come here. You have aides and personnel, and some of them unruly convoys with noise pollution arising from siren and so on and so forth. So they spent several days away from their duty posts, every time, converging either in Abuja or wherever else they are supposed to meet. Now, if teleconferencing has been effective on this particular occasion, I think that is something that we'll recommend to their excellencies. Certainly not all kinds of meetings are amenable to teleconferencing, but it's one option that they ought to maintain, because the cost of a governor moving from a state, if you were to reduce it to Naira and Kobo, it can be huge, and sometimes the movements are fairly frequent.
It's all part of the new normal that we are talking about. And even before coronavirus, people have been using teleconferencing to host meetings across the globe, right? It could be in New York, and I'm in Nigeria, and somebody's elsewhere. You can be teleconferencing and having a meeting, right? And from what he said, it curtails, the amount of money spent in governance in this country. And, of course, our governors know how to show that they're in Abuja, for instance, like convoys here and there, siren blowing here and there, and all of that. And they will take with them a number of staff from their state, to Abuja, hire hotels and what have you. And some of these states are also having issues with payment of salaries and other developmental, matters down their state. So I would say it's a healthy development because there's corona, but I say it can happen even with corona after corona has disappeared.
Indeed, that's a silver lining coming from this. You recall that even the Minister of Aviation had to clarify that some 5 governors did make requests to have a flight across the nation, and it was turned down. So the silver lining now is that in future, we now have realized that we can use teleconferencing as a means of interacting and also carry out governance. That's electronic e-governance now going on. And not only the Governors Forum that held that, the National Council for Health also used teleconference. I understand the Northern Governors too are about to meet, and one of the critical issues they have to consider is the Alimajiri issue, and it's likely to be also by teleconferencing. So that's one of the silver lining coming from this.
That shows how much we need science and technology, and how much we need to have our own satellites to be able to, because this is satellite driven. It's powered by satellite. If you don't have a communication satellite, you may not be able to sustain teleconferencing in Nigeria. If you keep paying the big names in the satellite industry across the globe, it will take a lot of dollars, to do that.
Kieran, of course, the next stage beyond teleconferencing is actually video conferencing. So the more investments that they can make in all of that, that will be particularly helpful. I think that these are some of the lessons, takeaways, from this very unusual situation that humanity has found itself. Yeah. The other one, of course, relates to the way journalists are being treated by the Ebonyi State government. At some point, journalists have been ordered, arrested by the governor or by the chief security officer. A local government chairman is also, ordering journalists to be arrested. I mean, just what is going on? I mean, if there's an infraction of the law, then of course you prosecute the journalist. And there is a report that some of the journalists, including The Sun, which we are reviewing this morning, and I think Vanguard, they were said to have been barred for life from covering activities of, I don't know. I mean, of course, I'm sure we are those of us who remember, there used to be an African leader, his name was Idi Amin. Those were the kind of things you heard from him.
I'm not sure the governor was properly informed. These are our colleagues, and we play a very vital role in national development. And if anybody goes wrong in the process of practicing his profession, they will have laws in the country. But molesting or insulting or embarrassing journalists cannot be accepted. I mean, it is not. This is our profession, man. I mean, if we attack this way, that means we cannot function effectively and efficiently, in Nigeria and elsewhere around the globe.
In fact, with this critical moment in time where we are fighting COVID-19, journalists are among the essential workers at the front line.
Exactly.
And therefore, my only consolation is that the Nigeria Union of Journalists and the Nigerian Guild of Editors are taking this up. And they should take His Excellency, the Governor, up on that. Where we are not saying journalists are saints. If they have committed any error, they should be tackled accordingly. But this arbitrariness should be stopped.
Okay, now to editorials this morning.
The Nigerian Press Council, by the way, I mean, you were Executive Secretary of Press Council. So if you have a complaint, there is a redress procedure at the Nigerian Press Council.
Yes.
It's only when there is a criminal infraction, whether a misdemeanor or a felony, that you take somebody to court. But there are other ways you can resolve this. If it is broadcast stations have not been implicated, you have the NBC, which is a regulator.
Well, okay, gentlemen. We're running out of time. Actually, I think the regard of the governor is that they published a story or say that the military has besieged one community in Abia. That's what the story says. That the military has besieged. It was not true.
If it's not true, all they require is that to make in a protestation to the editor for a right of rebuttal. If they refuse, then they can complain to the press council and affect that.
Deduction from local government workers' salaries is the editorial for this morning from Daily Trust newspaper. The Bauchi State government stopped deductions from workers' salaries, but in Niger State, the story is different, as the government has decided to cut the salaries of local government staff by 20%. Of course, they said it's after a meeting between the council chairman and, of course, some local government workers union, but some of the workers union members like Norge and the medical aid workers and NTA are saying no to that.
Well, actually, the report is saying that the local government chairman, 25 of them met, and they took a resolution that they are going to take 20% of the salary of local government workers. They want to use it to provide facilities to fight COVID-19. And they got the consent of the Union of Local Government Workers, Nigeria Union of Teachers, as Medical and Allied Workers Union. But what the workers are saying is that they have no justification for this, because the argument is that their allocation from the federation account is a shortfall, and what they are receiving after deductions will not be sufficient even to pay salaries. Therefore, they need to take 20% of salary to be able to supplement what they are having. But the editorial is now saying that they should follow the example by members of the National Assembly and ministers who gave out the percentage of their salary as a means of fighting COVID-19. If you are local government chairman, you have not touched your security vote, you have not talked about overhead costs, which you will not need during the time of shutdown when workers are at home. Why are you reaching out for the salaries of workers?
We're running out of time, and we have to end it here for today. And at this point, we'd like to thank you for your analysis. I'm sure you're going to be back again tomorrow.
Thank you very
for
much.
more. You're watching Good Morning Nigeria on the network service of the NTA. And now we're going to the next segment of our show today, which is, of course, the conversation aspect of the program. For now, we'll take a short break. When we get back, the program returns.
Coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person, who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
City Hawks. Let's go, guys.
Babe.
Yeah?
Would you please turn on your hotspot?
Okay, there you go. My lady. Ladies ball. Hey, put this guy down.
Password, please.
0808.
Baby girl, you are one in a million.
Babe.
Yeah.
You have a message.
From you, maybe? Read it out now. Read it out to my ears.
Nobody.
Free your mind with Airtel Smart Talk and enjoy calls to all networks at a flat rate of 11 kobo per second. Dial *315# to join.
Banger! Can I have your phone, man?
Airtel, the smartphone network.
Now believe this Koroti. You know if you touch black man. If you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give him?
Give me 200.
Take your change now. You don't want your change.
My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so e no get leg. Now we dey waka kurukere. No waka around, make the virus for die. No forget, say the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dear brothers and sisters, in view of the COVID-19 pandemic we are currently challenged with, we at Al-Habibiyya Islamic Society enjoin all Muslims to adhere strictly to government directives geared towards stopping the spread of the virus. These measures include the stay-at-home order, washing of hands with soap and water, using hand sanitizers where water is not available, and other hygiene measures. We remind you all of the words of Allah in the Holy Quran, chapter 2, verse 195, which says, "And do not throw yourselves with your own hands into destruction." We also remind you of the hadith of the noble Prophet Muhammad, peace be upon him, which says, "Do not cause harm or return harm." Please stay at home and stay safe with continuous dua. This message is from Project Itfine of Al-Habibiyya Islamic Society. Al-Habibiyya Islamic Society, from Allah to you, a light.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19, it's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please, help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6 foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
And I've got this very important message for you guys. Stay at home. No. Stay safe. Noruma. This is the right thing to do at this time. And don't forget, remember to wash your hands. Sachasia kage samaya sama, sachasia isia kage ofuma. Together, we'll beat this thing. Are you ready now? Are you ready, man?
All right, you're watching Good Morning Nigeria, reaching you on the network service of the Nigerian Television Authority. Now, as a prompt for our discussion this morning, let's listen into excerpts from our previous conversation on COVID-19 with situation reports on the states. This is put together by Victor Azum.
We decided to, first and foremost, lock down Kauru local government. We went ahead to say that we restrict movements in the state capital and other major suburb areas in Nasarawa state. We closed down the markets, in order to reduce this. Anywhere there are major gatherings, we decide to reduce that. You will see in the papers today the number of arrests that were made because of violation of some of these gatherings, one of which was actually at an event, of a wedding event that was held by one of the overseers of the development area in the state. And he also was one of those arrested, for violating of these kind of programs. We also went ahead with the building, of our isolation centers. So today we have isolation center, that is almost completed of 300 beds in Lafia. And then every one of the major hospitals, there is an isolation center and a quarantine area for those who are affected.
In FCT, we have 58 confirmed cases as of today. We discharged 22. We lost 2, unfortunately, as you are aware. The 2 we lost had comorbidities, the 2 of them. One of the most important updates is that our facility at Asokoro Hospital has come live. Presently, we have started admitting patients there. We have trained over 240 staff, mixed of doctors, nurses, pharmacists, laboratory scientists, including technical guys, those that fix the electricity, those that fix the water. So proactively we went ahead and trained these artisans that do maintenance. We also trained the security that guard the place.
All schools are closed down. All motor parks are closed down. All markets are closed down. Some of these measures, we started them before even the confirmed cases that we have today, because we believed that that was the best way to go. Many states thought we overreacted, but believe me, those measures have helped to reduce perhaps the number of index cases today. As it is, we have also strengthened the measures. We have continued to observe 24 hours lockdown, for the first 3 days, Monday to Wednesday. Thursday today has been a bit a window of for people to go and replenish whatever they are going to acquire, essential household items. And then we close again, for Friday, Saturday, and Sunday, and then open up on Monday.
In Anambra State, it's not only doctors and nurses we train, we also train cleaners, water cleaners, and they are very, very critical in the value chain. Secondly, I'm happy to announce that the Anambra State government has placed an order for the latest technology in testing coronavirus. The technology will make it easy for the result to come out. In 15 minutes, the result will be out. So you don't have to wait for 48 hours. I'm also happy to announce that Anambra State has what is called a mega lab. That is to say, a laboratory that can test 500 samples at the same time. It is located at the State University. The only difficulty we're having is that it doesn't have reagents. Reagents are now being ordered. We are also working on the Federal University Teaching Hospital in Inewi. We are assisting it so that it can also become a testing center. By the time we have these two, plus our latest technology, we should be in a position to assist other states.
All right, now all of those comments were as said a week ago, but we have seen also now a climb in the numbers, 873 total. Fatalities have also increased to 28 countrywide. So today again, we of course will be taking on reports from various states. Let's at this time welcome back again to our studios Dr. Mohammed Kawu. Mohammed Kawu is the acting secretary of the FCT Health and Human Services Secretariat. Dr. Kawu, pleasure to have you again on Good Morning Nigeria.
Thank you.
All right. And joining us via Skype from Asaba, the capital of Delta State, is the Commissioner of Information Delta State in the person of Charles Aniago. Charles, good morning and welcome to the program.
Good morning and thanks for having me.
And also joining us from our Sokoto studio is Dr. Muhammad Ali Name. He's the chairman, Sokoto State Task Force on COVID-19. We would like to thank you for joining us again this morning on the show.
Good morning, Nigeria.
And Kingsley, the importance of this program cannot be overemphasized, and that's why we look forward to talking to a state chief executive on a daily basis, if we can. And we are learning that the Adamawa State governor is going to be joining us in the course of this program. This is Richard's via Skype. His name is Amadou Omar Fentre.
Okay, Kirian, we of course know that Kano is now on the map of infected states, and in some cases also very peculiar. We've always spoken to officials from Kano. Today we are having another official join us. It's Dr. Tijani Hussaini. He's the coordinator of the Kano State Technical Response Team on COVID-19. He's joining us from our Kano Network Center. Dr. Hussaini, pleasure to have you with us on the program this morning. Kano Network Center. Dr. Hussaini, pleasure to have you with us on the program this morning.
My pleasure too. Listeners, good morning.
Let's begin with you, Dr. Tijani Hussaini. Tell us what is happening in Kano at the moment, because we hear all kinds of things. The unexplained death, well over 150 persons, it was said, within a matter of days, and then suddenly your testing center closed shop, and the place is said to be undergoing decontamination. The task force is said not to be meeting regularly. Exactly what is happening in Kano?
Good morning, listeners. I think Kano, there is a lot of stories going out that are not true. The Kano state, yes, within a very short period of time we have escalation of cases, and from 1 to 73 in like 13-14 days. But again, that is, for me, is expected, because previously Kano doesn't have an active testing center. It means we have to take our samples elsewhere. So our testing capacity is not there at all till on the 8th of April. And you are fighting a disease that you must find who are those infected. And without testing, you might not. So as soon as testing began in earnest, in numbers, then you begin to see cases rising. And that is no magic at all. But the important thing is Kano State, even before the discovery of the first case, has put mechanism in place to ensure that if we have these cases, there are ways to manage them. And we are doing that very successfully. We have at least 2 isolation centers, one in Kwanar Dawaki isolation facility, and the other one at Muhammadu Buhari Specialist Hospital. These are our 2 active facilities. However, with COVID and Aliko Dangote Foundation, we are on the process of putting up a temporary isolation site that is envisaged to take about 500 clients. And we are not only stopping at that, we are looking at other facilities to ensure that people are taken care of in case we have explosion of cases, which we don't hope for. But again, we need to get prepared ahead of time. And while, yes, you might say, people will say there are increased number in death, but again, this is observers telling you this. Scientifically and public health physicians, you can only verify if you do proper investigation. Naturally and normally people should die. That's a natural cause. That's natural to life. However, how many are attributed to corona death, that's another thing entirely. And because of this concern raised, especially in the social media, the Kano State Task Force, the Kano State government constituted, we've gone to do some verification, and our process, the results will be made public in due course. And trying to ensure that, since there is this observation by citizens, we are instituting a measure to have data taken from our graveyards. And this is on electronic platform that can easily be transmissible, and we now do analysis and see which one can be attributed to coronavirus. And this inshallah, in the next, by tomorrow, this system will take off. And we are instituting community surveillance, ensuring that we are following, actively searching for these cases and ensure that they are put under treatment. So many fake news are coming out of Kano. And for those who have been working in the lab, they know that lab doesn't work continuously with non-stop. There are times when you need to fumigate, ensure that you maintain your integrity, ensure that you have not introduced infection, ensure that all your things are in order, have that required quality control, so that we are not giving false results, we are not giving unverified and test results that are not of quality. And this is a routine process. Even the all other centers do have this kind of shutdown, and not very shut down. And it will come in by today, tomorrow, the testing will come back again. However, even while this facility is shut down, we have not stopped transporting our samples. Even yesterday, our samples are in Abuja, and they are going to be processed in Abuja. And we stationed vehicles here in Kano and also in Abuja, so that samples can be transported at any point in time. Yes, it may be slow since the testing facility is not on site. I mean, in Kano, but it's in Abuja. So that time lag, yes, could be there. But again, we have put mitigation in place.
Thank you, Dr. Hussaini. We'll have to come back to you, because the other leg of the question was on the mass deaths recorded in Kano, which of course there's not been any autopsy to determine what actually happened that resulted in many people dying in Kano. But that will be when we come back to you in the course of this program. Now, let's go to Sokoto, where we have Dr. Muhammad Ali Name. Sokoto State was coronavirus free until about 3 days ago, when it recorded its first index case. Now, give us a sense, if you could, of what transpired and the situation on ground. How is Sokoto grappling with that? Give us an idea of what the plans are by task force in Sokoto to, of course, grapple with the unexpected.
Morning. In Sokoto on the 19th of April, we reported our first confirmed case who is currently undergoing treatment at the isolation center at the infectious disease hospital, Amanawa. Immediately, we have been conducting contact tracing, where we have a list of about 32 contacts that we are tracing currently. One of the challenges that we have up till this moment, we have been trying to know exactly and trace who was the first index case that have been able to infect this current case in particular. So we've not been able to, because this index case does not have any travel history, has not traveled out of Sokoto for the past 4 weeks or 5 weeks. So we are really concerned about that and trying to find out where this index case gets infected. Otherwise, I think we have to agree with the fact that there is some level of community transmission in the state. And for that, we are planning to continue or to start active case search within the community, particularly in the local government where the index case resides. And again, another challenge that we have been also trying to mitigate or address is the trooping of returnees from other states into Sokoto. And this also made the task force to be more active, involving community leaders and traditional leaders, so as to be able to track all the returnees into the state and making assessment of those returnees to ensure that we are able to forestall and contain the spread of the disease in the state. So far, this is what we have been doing actively, and also other areas that in terms of risk communication, raising awareness of all people in the state about COVID-19 and how to prevent its spread.
Thank you very much, Dr. Name from Sokoto. We'll return to you in the course of the conversation. Earlier, we introduced the Commissioner for Information of Delta State, Charles Aniago. Mr. Aniago, give us a sense of what is happening in Delta. We know that Delta was one of the states that earlier launched an aggressive lockdown, of its entry and exit points. So what exactly is the story now with regard to the coronavirus?
Thank you very much. Like you rightly mentioned, sometime about the 28th of March, we imposed some form of lockdown by ensuring that we don't have entry into and out of our state. And then also we closed down the Asaba airport to prevent people from coming in. And then on the 1st of April, we imposed a total lockdown in the state, and then we decided to close the normal markets and then created some temporary markets so that marketers and those who come and buy who can maintain a level of social distance. All this was with a view to preventing at that point, the outbreak of the pandemic and possible spread in the case that it comes in. But that also assisted us. But 7 days into that lockdown, we recorded our index case, who today is also doing very well. But thereafter, the second case, before the result could come out, the person passed on. And that's the death, one death that we have out of the 6 that we have now. So at the moment, we have 6 active cases in Delta. 2 of them were reported yesterday. But before yesterday, we had 4 active cases. At least 3 active cases in the state because one passed on, the 4th person. And so far, it's been one issue that had made us to continue to sensitize our people. But prior to that time, we had already established 4 isolation and treatment centers. That was prior to even the outbreak of the pandemic in our state. And today, we are taking advantage of these treatment centers to cater to the needs of these 5 active cases. We can also report that beyond that, the state government have also taken a number of measures, including the production and the possible distribution, free of charge, of face masks, which will start distribution at from Monday next week. And we are targeting about 1 million face masks. And in addition to that, we are also reaching out to our people, also letting them know the different protocols and what they need to observe, the issue of hand washing. They need to maintain physical distance, and indeed for individuals to stay at home. And when there is a need for you to come out, you must also observe those rules that the medical professionals have made very, very clear that such protocols will assist in the reduction of the spread of the pandemic. We give God the glory that our number is low. We hope that it remains low, even if we have been able to establish top-notch isolation and treatment centers. We are not praying that we use them. But should the case arise as it has arisen already with the 5 active cases, we will continue to take advantage of that. But also in addition, we have trained a number of health personnel and other support services. No fewer than 90 doctors were deployed for the purpose of this COVID-19. These doctors were doctors that were hitherto performing some medical function in other facilities in the state, but we trained them purposely for the purpose of attending to issues of COVID-19. We have also trained a number of nurses. We have trained a number of drivers. No fewer than 12 ambulance drivers were trained to man the ambulances that were dedicated for the purpose of this. You do know that before now, it was only in Irua that catered to the needs of states in the South-South. So we still take our samples to Irua for testing and then confirmation of the status of anybody that's suspected to have the virus. And we have also, because we know the impact of the close down on our people, particularly bearing in mind that a number of persons survive on day-to-day basis by having to work today and then feed tomorrow. As a state, we have to, beyond having to budget some amount and then provide some palliatives, we pleaded with our well-meaning individuals to try as much as possible to assist to fill in the gap, because we are quite mindful of the fact that there is no how the state government can afford to feed everybody. But in doing so, we targeted the very vulnerable members of the society. so that at the end of the day, we're able to at least meet them halfway. That's where we are at the moment.
All right, Charles, thank you. Now back to our studio here in Abuja, where we have Dr. Kau Mohammed, Acting Secretary, FCT Health and Human Services Secretariat. Now, Abuja is recording more cases. Sometime last week or thereabout, you commenced a case search in Piper, is at that town, and perhaps Mabuchi and other areas. Where is this number coming from at the moment, and how much of testing has been conducted in the suspected areas in the satellite towns? Because, of course, we've been running away from having a community infection, but the records are showing that something different has happened. Eventually, the virus may have entered the satellite community. Lead us into this.
Thank you very much. When I came last time, I expressed the fear of FCT administration and the society concerning community transmission. And that made FCT to start active search of cases in the communities. As we said, we started with Mpape, we went to Mabushi, Gishiri, and some other areas. As of today, in the communities, we tested 567 patients. Out of that, 46 are confirmed. So we have established community transmission. And that is serious, but not to say that I'm scaring anybody. But we have to know that we have community transmission. So strategies have to be put in place to ensure that we quickly do the needful and get all the people in the communities that are infected isolated to the treatment centers, managed. Then all those that are suspects, high index cases, the FCT administration have approved that we get hotels and other suitable places to quarantine them. Now, the issue is, unlike in the city center or where the elders live, in communities, you find 10, 15 people living in the same compound, maybe a 2-bedroom or 3-bedroom house. So if one of them is infected, how do you isolate that person? Or if you suspect that person has infection, how do you isolate him? The mantra, the policy was to self-quarantine, test every other person. Anybody found positive should be taken to the treatment center. So we find that it's not possible in the communities. Now, the other big challenge in this is you can't quarantine people in a hall or in a ward. If you are quarantining people, you have to get, each person should have a separate place, room. And each person should have his or her own toilet, separate, and bathroom. So we find that it's only hotels that can provide that kind of facilities. So the FCT administration, specifically the Honorable Minister, called EOC meeting 2 days ago, and we have agreed we'll go to these communities, get the hotels around those communities. We've started that. And as many as possible, any high index of suspicion should be taken to those places for quarantine. And then the confirmed cases to be moved to treatment centers. As I said earlier, we have up to 4 active ones with bed capacity of about 150, while other areas are almost completed. In total, we have about 600 bed capacity for isolation and treatment. One interesting thing is that the military has joined us in FCT. They have been part and parcel of our EOC, and they have also isolation and treatment center, they are fixed along the airport road at the Air Force Base. So we are doing active case search and treatment, and that these patients, when they are identified, they are taken for treatment. And the other challenge we've been having is when you get to the communities, they are not interested in testing. They are more interested in the palliative. And you can understand, people have not been going out for the past 2 weeks or so, or even more. So FCT administration has started distributing palliatives. Started with Abaji, Kwali, today they are in Kuje. But what we agreed is, since the burden is in the city, in the suburbs of the city, around Mabushi and other places. So anytime the committee, those for active search are going, the palliative committee will go first and distribute palliatives for them. Then the active search and surveillance team will follow them. Most importantly, what we do when we get to the communities, we take the vulnerable people first. Those that are working in the PSCs, those local barbers, those selling medicines, and those that have symptoms. So for each community, we establish a center at the PSC where people will come voluntarily and get themselves tested. And they have been coming.
Now, apart from the initial locations where you undertook the active case search, Mpape you mentioned, I think Gwarimpa and Kubwa and Utako were also part of it. Where else is active case search going on or testing going on in the FCT?
Yeah, because of the capacity, you have to be systematic. So we have started in Mabushi, Gishiri, Mpape, and we are moving to Nyanya, Karu, Jikoi, and all the suburbs, especially surrounding the city center, before we start expanding to the other areas.
Okay. There's a whole question, Kisley. How do you determine the areas to go? If you enter Karo, we have New Karo, we have Nyanya, we have Jikoi, and how do you start this? I'm just beginning to think of the difficulty involved in even taking decision as to where to start this search. If because of the way people live in those areas, they live in clustered forms, and I want to know what determines where to start.
Well, we have taken decision that we are going to all the communities, but what we are saying, which one to start with, we're working with the WHO and other highly specialized agencies that will, based on contact tracing of earlier infected patients, you now say, well, it's most likely, if you go to this place, you are most likely going to get active cases. So based on that, we are mapping on which way to go, which community to go before the other community.
Just Dr. Kao, I mean, when you say that hotels will serve as quarantine centers, exactly how will the hotels function? Are you going to be feeding them? But how will the hotel function?
It's automatic. Any corona patient or suspect is government responsibility. Any. We arrange for the hotels, we pay for the hotels, including feeding, water, soap, everything. That's what I'm telling you. It's not a small thing.
I'm concerned about how the hotel itself will function. Because, I mean, Kirian, you have housekeepers. You will have those who are in the kitchen. That's in the catering department. Are they going to be coming in and going out? Because, I mean, if you are observing persons in quarantine for 14 days, and then you now have hotel staff who are attending to them, and then the hotel staff themselves don't spend the night, or the hotel staff are not similarly quarantined with them. How does this work out? The hotel staff works there?
No.
How does it function?
No. What happens is exactly what happens at the treatment center the same thing is going to happen at the hotels.
Okay.
At the Asoko Hospital, for instance, we serve them food. People cook food and bring in packed plates, rubber plates, packed with spoon and everything. For the train staff, the nurses, the hygienists, that is the cleaners, they are the ones that enter the rooms, clean the rooms, serve them food. So the hotel will just cook their own food and now give those that are going to train, that are going to manage those in quarantine. The same thing with those that have been on admission. So the hotel's management, they are not exposed at all. Their only business is to cook the food somewhere safe and bring it to the trained hygienists and other health personnel that will now deal with those guys. Those guys are well kitted and they will now manage those people. And anyone that is positive is removed from the hotel to the treatment center. Anyone that exists 14 days and is negative goes back to the community. And we have psychologists and psychiatrists that will be working on their psychic also before they are exited to the communities.
All right, thank you. Let's return to Kano one more time. We've lost the guy for now. He's going to come back as we're informed. But next is to Sokoto once again. Dr. Muhammadu Ali Name. Yes, you did explain that the Sokoto state government is quite prepared and some measures have been put in place to mitigate the spread of coronavirus. But let us learn more about what you're doing in terms of the PPEs and other medical supplies that are required, and again the facilities that have been established for this fight. Or are you going to rely on the normal hospitals that you have in Sokoto State? Let us know more about what you're doing, because of course Sokoto may have very few cases, but of course from what has happened in other states, it's been a fact now that where you have one, the possibility of having 10 is there.
Yeah, thank you. In terms of facilities, we have a 100-bed isolation center at Amanawa, where it's being used now. Our index case is receiving treatment at that site. Then we also have an additional treatment or isolation center at the Murtala Specialist Hospital in Sokoto with 38-bed capacity. As well as another isolation center at the Osman Danfodio University Teaching Hospital, which have our 10 beds capacity isolation center. That's as far as facility is concerned. And then another important update is the activation of the testing center at the Osman Danfodio University, Sokoto. We hope that the testing center, the NCDC will activate this testing center today. Then we'll be able to test our patients early enough without sending our samples to Abuja, where we have a lot of time lag that will hinder us from taking immediate actions. So this testing facility will help also other neighboring states like Zamfara and Kebbi, where they will be able to also test or send their sample to Sokoto for testing. In terms of, we've been able, the state have provided personal protective equipment for all hospitals in the state, especially the secondary health facilities, that is the specialist hospital, as well as the 22 general hospitals. We have provided those PPE materials for the health workers in the state. And again, the Executive Council of the state, Sokoto State Executive Council, have approved the 100% increment of the hazard allowance to all health workers of the state for the month of April, which has already been paid, as well as for the month of May. And again, we are providing weekly allowances for all health workers that are in the front line, those that are managing the isolation center, and again those that are in the front line at various points of entry into Sokoto, those that are carrying screening activities of people that enter the state. Again, I just want to emphasize that we also implementing the non-entry order into the state for a period of now 27 days. We have been, even prior to the confirming of the in this case, we have been on partial lockdown of the state, especially in the interstate movement, and again also making or looking closely at our borders with Niger Republic, because we have about 4 official entry points at the borders in the Republic, with Niger Republic, with various local governments of the state. So we are closely monitoring those entry points, knowing fully well that Niger Republic also have rising cases of COVID-19 of recent time. So far, so good. These are some of the measures that we are carrying out. Now that we have confirmed that we have a case in the state, we will be more active in the area of case search, active case search in the community. As I earlier mentioned, that we have not been able at this moment to trace the source of the infection of that in this case. So we have to be very vigilant and very active in an active case search in the community to forestall and contain the spread of this disease.
All right, thank you very much, Dr. Name. Let's bring back Charles Aniago, Commissioner for Information in Delta State. Mr. Aniago, tell us just how effective your measures have been in terms of now seeking to disrupt and ultimately eradicate community transmission. We know that you have boundaries with Edo State. You also have a boundary with Bayelsa State and then Anambra State. In the early days of the closure of these entry and exit points, we were told that some persons were breaching the bridgehead into Onitsha. Now, what exactly is playing out now? Have you succeeded in actually shutting down those entry and exit points, and what's happening with regard to community transmission?
Let me say that we give God the glory for the insight that He gave to the governor for us to shut down even before we recorded the first case in Delta. And that closure of our boundaries and indeed the eventual shutdown of the state has assisted us so much. And the reason why I say so is that if not for the shutdown, perhaps we would have seen some of these persons infected with the virus having to democratize the spread. We've been able to also maintain a very high level of surveillance on the contact persons who have actually had contact with these other persons. The reason why it's possible for us to do so is because of the restriction. They were not able to move from one place to the other as they would have done ordinarily. At the moment, we'll have a surveillance of about 140 persons. And I can tell you that if not for the closing down of the state, you would have seen just even one person traveling possibly from Warri to Ughelli to Asaba, and then visit a number of other places. Perhaps they would have also had cause to go to a particular market. And you know, when you go into the market, even if you touch 1 or 2 persons who become infected, you know, of course, the ripple effect of that. So that, to a very large extent, has assisted us, and that I believe made it possible for our number to still remain a little low. Then with respect to the boundaries, at the initial time, it wasn't that easy because Anambra did not lock down on time. Bayelsa didn't also do so, and Edo. So we had problems from these 3 flanks. From Edo angle alone, we have no fewer than 9 entry points into the state. But as time went on, of course, they themselves saw what was also happening in terms of the spread in the state. They saw the need for them to also bring into force some other measures, just as we did. And we have also been able to take advantage of the security agencies in the state and the sensitization that we've continued to carry out, and get our people to realize that it's not in their interest for them to move around. It is true that our economy is affected, that of the government and indeed that of the people, But we made them realize that it is easy at the end of the day for us to bring back an economy that is dying. But we do not have the capacity to revive a dead man. And so we chose the option of allowing the economy suffer while we keep our people alive. But the challenge is that just like every other state in the Federation, the people survive largely on subsistence economic basis, where you have to work today and possibly eat tomorrow. And when you don't work tomorrow, it might not be easy. Those who go to work today, like keke drivers and Okada riders, and some other persons who work as bricklayers, and even those who are into some form of petty trading, that may just carry out a business today for them to feed tomorrow. So that challenge will necessarily force people to go out of their houses even when you ask them to stay at home. And that informed our decision to plead with those who are well-meaning, those who are also endowed by the grace of God to assist government to at least provide palliative to these our people. And as a government, the first thing we even did before the closure was that we ensured that we pay the salaries of the civil servants on time. You may want to say, yes, ordinarily we should pay them. But we believe that when they were paid at that early time, it made it also possible for them to also go and shop. And in doing so, they're also able to take that funds into the system. And thereafter, we now went ahead to provide the palliatives that came from the government. That does not in any way forestall all the challenges. The challenges are there. We continue to sensitize our people, and we are quite optimistic that the cooperation we have received from our people so far, if we continue along that line, we will, to a very large extent, limit the spread of the virus in the state. And the training of the personnel, and what the governor also did to ensure that every day, all the medical personnel and other support staff that are in the line of service with respect to combating this COVID-19 have also been taken care of. Today, any doctor who is assigned to take charge of the patient, all the doctors who are involved in this exercise, earn as much as 20,000 naira per day. That is not what any other state in the Federation is doing at the moment. I'm talking about per day, not per month. All the other nurses takes as much as 15,000 naira per day. Then when they are off duty, because we also provided accommodation in the area where we have these 4 isolation and treatment centers. When they are off duty, they take half of that money. For the cleaners, drivers, and other support staff, they take as much as 10,000 naira per day. If you match that to the fact that nationally what you had before now is 5,000 naira as hazard allowance per month per medical personnel, you will understand the number of percentage increase that were put in to motivate these individuals who are in the line of duty that we believe to a very large extent assist us in combating this virus and then keeping the rest of us alive. You will understand the reason why the state government have to take that particular decision. We do hope and pray that by the grace of God, that all these measures will assist us not only in limiting the spread of the virus in our state, but it will make it possible for us to bring back our economy so that we return to our normal life, which we really, really miss.
Well, if you ask me, many state governments, should emulate what Charles has just told us with respect to, motivating the people on the front line, because these are people who are taking the highest risks.
Yeah, Kieran, that's true. But I wouldn't know. The FCT acting Secretary for Health is here. There were reports because he's saying that Delta is the first to do it. We do know that the FCT has also increased the allowances of medical personnel who are involved in all of it. There were some reports that it was 50,000 naira. I'm not quite sure what the exact numbers are, but certainly, I mean, it's something that should be emulated.
Exactly. That's just the point.
Charles is beating his chest in the meantime.
Exactly. Yeah, that he's doing that with some level of panache. He's a professional colleague. Okay, now let's return to Kano. Dr. Tijani Hussaini has also rejoined us. Dr. Hussaini, sometime last week, and in the social media as well, Nigerians were treated to some bad news as to the number of deaths recorded in Kano, not connected, to the coronavirus anyway. It's unconnected, which means that there may be a strange kind of disease that has besieged some parts of Kano State. Do explain to us what the true situation is, because the argument has been that there was no autopsy to determine the kind of disease that has affected the persons that died, to a point where workers at the cemetery are complaining of a lack of space to bury people. Just make it clearer for Nigerians to understand what happened and what effort government has made to determine what is responsible for those mass deaths in Kano State.
Thank you. For me, the numbers being peddled, especially in social media, that one report says one burial ground received about 100. For me, that is an unverified data. That's unverified information. Yes, we acknowledge that people have seen observed increasing number of cases. However, we need to remember that Kano doesn't have cemetery registers. We should remember that we do not have baseline. So there is no way to compare and say, yes, the number of death is rising in Kano. Like I said earlier, death is part of human life. We must all die. However, attributing it to COVID, that will be preempting. That is unscientific. However, immediately we saw that report of increased number of death in Kano. We sent our health workers to all these cemeteries in Kano and ensure that we get the proper record. And what we have preliminary, it shows that yes, the numbers are there, but it doesn't make sense to us because we do not have baseline to compare with. But even at that, the number of deaths moving forward, they are actually tapering down. Perhaps it can be anything. And Kano State instituted some investigation to ensure that we get to the bottom of it. And we have instituted surveillance in our cemeteries. And this surveillance will take off tomorrow. And we are going to train our health workers to ensure that they take all the details of people who are brought to these cemeteries, take the basic symptoms, what they have died of, and then go back to their communities and ensure that we link up and do proper investigation. This process is on. And we also instituted active community surveillance, where we now go into community, into households and ensure that we ask people with symptoms of coronavirus and ensure that we get to them early enough, we track them, we take them to isolation so that they don't continue to spread the disease.
Thank you very much, Dr. Tijani Husseini. I mean, you've raised a number of points. Just to indicate that, I mean, we've had officials from Kano speak to us on Good Morning Nigeria with regard to the preparations they are making. But the reports as to the unexplained deaths, those reports certainly were not fake, because there were grave diggers who were said to have indicated that their work rate had increased at the time those cadavers were coming in. But we do hope, as you have said, that your active case search will proceed accordingly, and that the social distancing, which is very important, is now being strictly enforced, because there were also videos that circulated of football matches being organized. In fact, we had Professor Issa Sadiq Abubakar, who is of Bayero University. He joined us from Good Morning Nigeria a few days ago, and he said those football matches were going on. They called it Corona Cup. You know, it was like a mini stadium that you had persons all over the place without maintaining social distancing. But some of the points that you have raised have been noted, but we also hope that you take note of the concerns that members of the public have pointed out. It's Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. We'll take a short break now.
Our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain if we do not learn from other countries and observe the lockdown to stop the further spread of the virus? If we lose our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian to unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
You've seen me promote Lifebuoy soap, but today I urge you to use whichever soap that is nearest to you, because washing hands with soap helps to fight the coronavirus. This is a public service announcement from Lifebuoy.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
Over the past few seasons, Airtel Touching Lives has helped to empower and uplift thousands of Nigerians. And this season was no different.
People are really suffering.
I still have a hope.
I know that God doesn't leave things halfway.
Thank you to all our viewers for inviting us into your homes and sharing in our journey as we continue to change lives.
As a strong immune system increases the chances of victims surviving COVID-19. A corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19, it's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please, help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6 foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
Yeah, we thank you for staying with us on Good Morning Nigeria today. We have a good reason to return to Dr. Tijani Hussaini once more, in Kano. Dr. Hussaini, many things seem to be playing out in Kano presently, considering the way and manner that COVID-19 is being mitigated in Kano. We hear that a number of Almajiris are being moved from Kano to different parts of the country. Trailer load of Almajiris, and of course that the Kano state government said that it's going to transport 1 million Almajiris from Kano to different parts of the north where they come from. And the question is, why now, of all times, to move, the good number of people, to different parts of the north? Now that we are talking about the spread of COVID-19, is it the right time to do that? And again, some people have said that some people in Kano are living in denial with respect to the severeness and seriousness of COVID-19 and its spread. So tell us more about this movement of emergencies and the other containing issues, because I raised an issue with you a short while ago with respect to mass deaths, and you said that people must die, it's natural, good, but when they come in numbers and they cannot be explained, then it becomes scary, you know. So Nigerians are scared because Nigerians are feeling for Kano because of its population. And whatever happens to Kano definitely might, of course, spill to other parts of the north.
Thank you, Karen. For the movement of Al-Majiri, I'm not too sure I'm too competent to speak on that. That's a policy level decision, and which again I am not competent to comment on that. However, this is my personal opinion. One of the measures necessary to control this outbreak is social distancing. We know that these Al-Majiris live in a very perilous condition. They live in congregation where the spread of this disease will be very ripe. So leaving them to live in such conditions and in congregation exposes the whole community to coronavirus if any of these Al-Majiris is to get the disease. And remember, some of these Al-Majiris go into houses begging for alms, doing household chores and so on and so forth. So there could be vehicle for infection into households that even self-isolate. So for me personally, I think, yes, it's the right time to move them. It's the right time to ensure that we enforce this Al-Majiri thing we have been talking about. I remember each and every, there is opportunity in every situation. Perhaps we will live in post-COVID time. Perhaps COVID has afforded us this opportunity to deal with this Al-Majiri issue once and for all, and to see how we reform the institution. We see how we move it from where it is now to where it should have been. And perhaps coronavirus disease is affording us this opportunity. But like I said, I'm speaking as an individual, and this is not policy level statements I'm saying. I'm not competent to speak on that. Yes, on the number of deaths, I'm not denying people are dying. I'm not denying that. What I said is the numbers are there. The numbers are unverified. Yes, people are dying. Yes, perhaps there might be an increase. So it will be prejudicial to state that we have massive death. Massive death is a judgment, and we do not have sufficient data to pass this judgment. What we are doing is instituting systematic investigation, systematic surveillance to establish, yes, these deaths, yes, there is increase in number of deaths, yes, this could be as a reason. I mean, we could also postulate as possible reasons why there are these deaths. And like I said, Kano traditionally doesn't have registers. Burial ground registers. We do not do autopsies. So whatever we say is speculative, and as public health officials and those who should provide the right information, we are not engaging in speculation. But I wish to state categorically, Kano State government is going forward to do this investigation and to ensure that we institute surveillance in our graveyards. And on people living in denial, yes, even in the US, even everywhere, in the UK, everywhere, where the pandemic is even much, much higher than here. There are people that do not believe COVID even exists. So many conspiracy theories abound everywhere, and Kano is not exempted. Yes, there are people in Kano who live in denial, who believe COVID doesn't exist, but it exists. We have 73 cases isolated. We have 73 cases that are on treatment, and this is very, very true. However,
all right, I thank you very much, Dr. Tijani Husseini, for your comments. I want to return to Dr. Name, who is the chairman of the Sokoto State Task Force on COVID-19 in our Sokoto Network Center. Dr. Name, tell us, if you, do we have a sense of just how much public awareness there is with regard to COVID-19, its mode of transmission, and what to do to prevent the transmission, particularly with regard to social distancing. I'm saying this, because against the background of the admonition by the Sultan, His Eminence Saad Abubakar, with regard to the forthcoming Ramadan, how much public awareness is there, and do you expect that there might be breaches of social distancing and other measures that ordinarily would have facilitated the containment of the virus in your location?
Yeah, thank you. With regard to public awareness, especially speaking about risk awareness among the general public, is very, very high. People are very much aware of the disease that is existing and also its mode of transmission and so on. However, the challenge that is there is about perception of this risk by the general public. That's where there is the challenge. We have still some people that are having questions about whether this disease is existing or not. But the risk awareness in terms of awareness of the general public about the existence of the disease is very high. And this is as a result of the feedback we do get from the general public on daily basis. Especially we have toll-free lines that we have shared with the public, and people are every day reporting complaints about possibility of people having symptoms, and also reporting cases that returnees and also some of the people coming from the Niger Republic. So the awareness is extremely high in the state. However, the perception about the disease is where we have challenge. And again, with the regard to the forthcoming Ramadan, where congregations and tafsir are being stopped, we hope that to continue creating awareness, especially with collaboration with the clerics and ulamas, to educate people on the need and the basis why those decisions were taken, so that people will understand that it's for their best interest and the benefit of the whole society.
Dr. Abuja here, very briefly, Dr. Kawu Mohammed. Let's talk about treatment. We hear about repurposed medicines. We also hear about treatment protocol or treatment therapy, because of course there's no cure for COVID-19. Would it get to a point, where all medical personnel in Nigeria will understand this treatment protocol if things get out of hand, and at the point when we have all our hospitals are saturated, and that there will be need for private persons in the health sector will be involved. Why are we not knowing the process that Nigeria is adopting in terms of treatment? In America, of course, we hear suggestions and all of that, chloroquine suggestion by the president, which was turned down by FDA and all that. So what protocol are we really administering on the patient?
Yeah, thank you very much. As you know, it's a new disease. Even worldwide, there is no WHO standard of protocol. Each country adapts its own protocol. In Nigeria, there are 3 protocols. Each center takes its own, the suits it. So Abuja has its own protocol, and that is the protocol that is being used in the management of cases from Guagwarada National Hospital and
Why
Asoko.
not have a uniform protocol in Nigeria?
It's difficult because the physicians, everybody has, since there is no WHO standard, everybody feel, look, this is the best way I think these patients will be treated. Are you getting me? So, and if there is no World Health Standard, you are not obliged to use that standard.
Are you satisfied with the protocol being administered at the moment in Abuja?
We are satisfied in the whole country because, as you saw in a report somewhere, 90-something% of our patients are getting better. In any case, this disease is self-limiting. What it means is that whether you treat it or not, some people will get it, get out of it without dying. And most viruses are self-limiting. Most of the treatments are the symptomatic treatments. Now, it's like the simple flu. You can have flu. You go and lie down in a house without any antibiotic, without any drug, you still get out of it. Are you getting me? Usually you treat the symptoms surrounding it. If you have headache, you take paracetamol. If you have cough, you take cough syrup. If the cough is becoming infected, you take antibiotic.
And you know why I'm asking this question, eh?
Yes.
You know, I'm asking this question because we're almost getting into the season of flu. You know, we're getting to the season of flu, and that may be confusing, you know, because the symptoms are alike, you know. That's the
we're getting to the wet season.
And as you must have heard, the federal government has allowed some centers to try chloroquine, and some centers are trying.
Okay.
So it's trial. So if you are on trial, you cannot force people to use it. So until you use it and you have empirical.
But Dr. Kawa, I mean, thanks. Let me jump in here and ask this question. What is the average treatment time for a patient? Because it appears that some get out of it fairly earlier than the others. I mean, Governor El-Rufai was in there for several weeks, for example. On the average, you have an idea?
Yeah, maybe 7 days, 10 days. But what is important is each individual has his own level of immunity.
Yeah,
that's right.
So how you respond usually depends on your level of immunity and having some comorbidities. Because most of the people we lost are actually not lost because of the coronavirus, but because of the comorbidities that are there that have already brought down the immunity of the person.
And what you call comorbidity, these are what you call underlying illnesses such as cancer, diabetes, kidney problem, liver problem,
and
heart disease.
Age also plays a role here.
That's right. So we'll see that. Kieran, we have a number of tweets. Let's see how we can go through those tweets now. Kieran, you want to begin with the tweets?
Yes. Innocent Yawal James, states can't respond effectively, and compliance is an issue because some people still don't believe in the figures, which sometimes conflicts. The world is now preparing for the future. Where is Nigeria now?
Francis Obe, with the increasing number of COVID-19 patients being reported, there's need to increase the number of medical teams carrying out community investigation so that the lockdown can be reviewed to reduce the number of deaths arising from the measures.
From the way some state governors are handling COVID-19, it's an incontrovertible fact that some of them do not even believe it's real. Imagine some governors attempting to fly out during the pandemic.
All right, Chris Simeon, it says the index case in Sokoto had not traveled out of the state for about a month. Then how come he contracted the virus? Secondly, is COVID-19 an airborne disease? Well, we will answer this one for you based on our interaction over time. You can contract the virus even if you haven't traveled out of your location. Whether it's airborne or not, yes, it is airborne. That has also been affirmed by medical experts and more particularly WHO.
But you have to stay close to the person who has it before he can get it. Not that if you're walking on the street, you pick it up. Status Monday, New York. Some states are too slow enforcing the lockdown tenets until it becomes very imperative for them to do so.
Now, Samuel Ekwo says the federal government should relax the lockdown because it has proven very difficult to observe for the majority of Nigerians who live in abject poverty in the country. Well, the lockdown, again, we need to emphasize this. It's not intended to punish. It's not intended to punish people. It is to ensure that there is no community transmission because people move from place to place without a lockdown. All right, Mike Kaya, Kwadole, Jack Solomon, and several others,
yes, I think we have really come to the end of the show today. We'd like to thank you for watching, but before that, let's appreciate our guests. Dr. Tijani Husseini, coordinator, Kano State Technical Response Team on COVID-19. We thank you for being with us this morning. Dr. Kawu Mohammed, the Acting Secretary, FCT Health and Human Service Secretariat, we appreciate you. And of course, Charles Aniago, Commissioner for Information Data State, we appreciate you. Thank you so much. And of course, Mohammed Ali Name, Dr. Mohammed Ali Name, Chairman, Sokoto State Task Force on COVID-19. We appreciate your contribution. That's how we conclude today's edition of Good Morning Nigeria. We thank you for watching. My name is Kirian Umayo. Stay safe.